Hi everyone, this is Sean with the Massachusetts Weekly Public Health Report for Friday, October 16th, 2020. So let's start off by looking at cases under monitoring or quarantine. These are not confirmed COVID cases, of course. These are the ones that are people who have had exposure and are quarantined to see if they develop symptoms. This is where we stood last week with 3,837 people under quarantine. And we've seen an increase of about 300 additional people under quarantine. And this is, of course, people are entering and exiting quarantine all the time. So this is just showing how the volume is increasing over time. Now let's look at confirmed cases. This is people who have actually tested positive and are thus in isolation. So this is where we were last week. And I'm going to switch to the next one, but they have actually switched two of the categories in this. So the total deaths and total cases currently isolated columns are going to switch for the next one. That may throw you off there as we go forward. We currently have 8,162 as of last week. As of this week, it's 9,762. So that is a massive jump there of 1,600 additional people in isolation from where we were a week ago, to bear in mind there. All right, now looking at our hospitals, we are seeing steady increases across the board here. Slight uptick in hospitalizations, ICUs and intubations, everything's trending up. And as case counts continue to rise, we should expect to see these continue to rise as well. Now, remember on the worst day in Massachusetts of the pandemic, which was April 21st, there were 3,965 people in hospitals across the state, 1,050 people in intensive care units, and 842 people on ventilators. So we're still a long ways off from that, but we are increasing. So seeing who is currently getting sick these days. In the last 2 weeks, the average age for COVID cases was 38. That's 2 years older than it was a week ago. I would guess this may have to do with there being fewer infections related to colleges in the last week. The average age of hospitalization has stayed the same, and the average age of deaths has dropped down a year. So looking at how our contact tracers are doing, so as case counts increase, it's going to be harder for our contact tracers to get to all the new cases. So across the top there, I've got the totals from the entire pandemic and how much of those cases we've reached, and we've actually gotten over 92% of all cases there, which is great. But now if you compare below, we've got the previous 2 weeks, or sort of the bottom, we've got the last 2 weeks, and then we've got the 2 weeks starting last week. That makes any sense at all. So as you can see, we've gotten, because case counts are going up, we're actually reaching more people, but a smaller percentage. And a key one metric to look at there is last week, our contact tracers were able to get to 84% of new cases within a single day of their positive test result, whereas this week it was only 80%. That is still, with the significant increase there, it's probably getting to more people within a single day, but as case counts get higher, this stretches the limits of contact tracing, and the longer it takes them to reach people, the more people that person might potentially expose. All right, so let's look at where in the state things are happening. So this map, as usual, shows the daily incidence rate per 100,000 people by town here. Towns that aren't showing up in the map have fewer than 5 total cases, and then we go green, yellow, red with increasing numbers. So this is where we stood a week ago, and here's where we stood at our latest update. So as you can see there, there is more yellow turning red, more green turning yellow, and more communities that were previously in the gray now showing up in color on the map. So spread both horizontally and vertically, which I'm pretty sure is not an epidemiology term, but I'm using it. So another thing to look at there is the state daily rate was 7.3 new cases per day per 100,000 people last week. Now it's 8.7. So we've gone up quite a bit there. In fact, so many places are in the red these days that I wouldn't be surprised if trends continue like this, we may actually see this scale become redrawn to if just to kind of more accurately show how spread is going throughout the state. All right, so the other component looking at this is, of course, percent positivity, which is what percentage of COVID tests are coming back positive in any given area. So here's where we stood last week, and here's where we are now. So again, percent positivity is also up. We were at 1.01% last week. We've gone up to 1.17% this week. That is, I believe, the biggest jump we've seen so far. And again, areas with a higher percent positivity may have the highest spread or may have insufficient testing for that area. I'm looking particularly in northeastern Massachusetts, along the New Hampshire border there, where I know there's a lot of communities that were showing up in red on the first map and are showing up in the darkest blue on this one. But we are also deploying a lot of tests these days. So higher percent positivities probably just mean in most areas, it's just lots more community spread. So looking briefly at how our colleges are doing, these are the data for higher education testing, since many of our colleges that have returned are putting out large-scale testing campaigns. So it's actually a lot fewer new cases in the last week. The week before, there were 211 new cases associated with higher education. This week, it was only 119. So that is a significant drop. And hopefully that means that colleges are kind of settling into their bubbles as the semester goes on, and community spread is dying up in those kind of enclosed college communities. Now there is a bit fewer tests conducted. It was 205,000 last week, and now it's only 108,000. But ideally, as spread diminishes, they can slightly scale down their testing to a surveillance level that doesn't need to get every person all the time. But on the whole, it seems that colleges are spreading less than they were initially and less than we'd feared. So that's good. So looking it's more at the state as a whole, here's what our 7-day averages have looked like over the last month. Now, with any chart in this scale here, the last couple of days are usually not up to date yet. So that drop off there is not something to get excited about. For reference, last Friday, last update, we were still on this uptick, and then we've well surpassed this. We're seeing close to 650 new cases a day on average across the state. And when it comes to the individual counties, I skipped over the last slide because I put it in but decided I don't actually like it. Here are all the counties that have trended up over the last 2 weeks. Now, some of them I've left off, the ones that are having smaller spread and are generally trending down. Berkshire, Hampshire, Barnstable, and Franklin are all fewer than 10 new cases per day on average, and I believe all of them or most of them are trending down. Or if they're trending up, it's fractions of cases. But this is everywhere else in the state that has been steadily or sharply trending up here. So you can see there's 2 clear bands here. Most of the state by area is on this kind of slow rise from the 30s-ish cases per day to into the 40s through 60s, and they're kind of spreading out. They're things obviously are much more closer when they're towards the much more closely clustered when they're at the smaller end of the scale, but now we're starting to spread out there with Plymouth taking the lead on the mid-range counties. But of course, our biggest spread is in the Northeast with Suffolk and Essex and Middlesex driving most of our case counts, all of them seeing more than 100 new cases per day on average, and Middlesex continues to be the leading county there. You can see how those case counts have wiggled their way up over the last 2 weeks there. All right, so that's it for the update for this week. One last thought before we go. This is just a great little public health graphic found online. I think it's been through several hands, but the last person to finesse it was Ian McKay, who is a virologist from Australia. This is the Swiss cheese respiratory virus defense, where basically you think of each public health intervention as a slice of Swiss cheese being stacked together, and every intervention has holes in it in ways that virus can spread through. But if you stack enough of these up, there will not be a path through them for virus to spread. And so I personally think that Swiss cheese is a better ingredient in metaphors than it is in sandwiches. I think this is a pretty useful model to look at to see how these layering of public health interventions such as masks, ventilation, hand hygiene are important in curbing spread when used together. Dr. McKay here has actually also put these in order from left to right of kind of the most effective to the least effective there. So, you'll see that your physical distancing on the left is going to be the biggest thing that will prevent spread, with surface cleaning being the least, but as you stack these up, they fill in those little gaps that might otherwise go through. All right, for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.